Thanks, Senator Van Hollen. Senator Braun.
Thank you, Mr. Chairman. The amount of time I've spent on this issue before I got to the U.S. Senate is a lot. I ran a business that exactly what we're talking about became the biggest issue once it was of a scale where it made a difference, and that started occurring back in 2008. I was finally sick and tired of hearing how lucky I was that my premiums are only going up 5 to 10% a year. That's the way you measure it in the real world. And a system that's built upon remediation with a very inelastic demand once you get sick or have a bad accident with nearly zero consumer involvement, there's easy to understand why we are where we are. It was pointed out, and I think very well in both opening statements. We're at that place where it's a tapeworm on the economy. The providers are the same, whether it's a government payor or a private system payor. So unless we fix the underlying system, don't expect much to change regardless of what we do here, because you can't, when it's that big a part of your economy, it's not free market. It's like an unregulated utility. If you want to really see what we've got as a healthcare system, until we get our consumers engaged on primary healthcare with their own skin in the game, for the ones that can afford it, you're probably going to have a system for those that can't, because I think in this country, everybody ought to deserve good health and well-being, but we've got a monstrous system that we've evolved into. I'm going to hope we have, with the number of people here, a second round for questions. Do you think that looks possible, Mr. Chair?
It depends, but possible.
Okay. So I'm going to start here. The largest sector of our healthcare economy is now hospitals, large corporate hospitals. Back as recently as 10 years ago, that was maybe a third. Practitioners, doctors and nurses were about a third. The balance being split between insurance companies and pharma. Now hospitals are just under 50%. The number of doctors I've spoken to that regret that they've gotten into the business because they wanted their own enterprise. They never imagined working for a big company because they had to due to the arithmetic of their business. I'm simply asking for one thing, that is transparency throughout the system like we have in all other markets. Get rid of the barriers to entry that we've created here in government, helping hospitals, keep doctors from owning their own hospitals and things like that. But I think that's where we need to focus. Secondarily, it'd be insurance companies because they work together in an opaque system. So I've had a couple amendments. One recently would direct CMS to publish a list of hospitals not in compliance with the price transparency rule that went through the court system to even get out there. That was done during the Trump administration. The other requires hospitals and insurers to share specific prices they negotiate across plans. Mr. Merkel, got a question for you. What other reforms should Congress consider when trying to take the biggest part of healthcare that is more and more corporate, embraces none of the aspects of free enterprise? Do you like those ideas, number one? And what else can we do that would start to crack at least where most of our healthcare dollars are being spent currently?
Thank you very much for your question. I think that you have hit the nail on the head with your diagnosis of the problem. We're limiting supply at the same time that we're increasing demand through federal programs, and we are not enabling consumers and employers because we've just put them in the dark. I would absolutely start with what you have said, giving consumers and employers price information to basically, we have left these powerful tools on the table, which are consumers and employers seeking the best value for themselves. And as you have noted, unfortunately, what we did in the Trump administration, the compliance has been inadequate. So the legislation that you have put forth to codify those rules, and I think increasing enforcement mechanisms to require them, as well as being clear who is being transparent and who is not, would go a long way.
One brief follow-up question, and I'd like this to be answered by Dr. Fiedler. Obamacare gave us, I think, some things that addressed the fact that everybody should have access. It should be at a price that you can afford. What about some of the things that have been dysfunctional? Like, I think what came from that, too, was that doctors cannot own outpatient hospitals, nor can they grow ones that were in place. Is that something that ought to be changed? Why was that ever done in the first place?
So I do think there were provisions on limitations on physician-owned hospitals. I am generally of the view that I think consistent with the question you're asking, that there's not a strong rationale for limits on the entry of new hospitals into hospital markets, and in particular limits on who can own those hospitals. I frankly think this is probably not the sort of main contributor to why hospital markets are as consolidated as they are. I think it's probably a fairly marginal factor, but I don't think I think the underlying rationale is that physician-owned hospitals may do a certain amount of cherry picking in terms of the patients they treat, and so other hospitals were concerned that they would be left holding the bag. I don't view that as a particular concern, and I think there's unlikely to be much harm done by removing some of these restrictions.
Thank you.
Senator Marshall.
All right. Chairman, thank you so much for hosting this hearing. My first question is